drain. The federal government makes moves to attract Nigerian health workers abroad. The federal government said it is making efforts to ensure that healthcare workers who have left the country to seek greener pastures return to contribute to the development of the health sector. The special advisor to the president on health, Dr. Salma Anas Ibrahim, made this known on Tuesday at the Joint World Health Organization Stakeholders Feedback Workshop on the evaluation on the third WHO Nigeria Country Operation Strategy or Cooperation Strategy and development of the fourth WHO Nigeria Cooperation Strategy for 2023 to 2027. Dr. Anas Ibrahim said the attainment of health for all programs through an efficient and effective universal health coverage system using the continuum of care model where no one is left behind as contained in the Sustainable Development Goals is the main aim of the present administration led by Bola Tinubu. According to her, President Tinubu's health sector agenda tagged healthcare a matter of right and urgency of the APC's Renewed Hope mantra has an action plan for a better Nigeria. She said healthcare reform policy agenda would align with the existing national health plan to improve the health fortunes of Nigerians through investment in governance and leadership, health financing, human resources, equitable, safe, quality service delivery, primary health care, secondary and tertiary care facilities, preventive care services, public health emergency preparedness and response, and increased partnership with non-governmental organizations. This government shall address the lingering nation's healthcare challenges, including inadequate health infrastructure, fragmentation and overburdened workforce, poor insurance coverage, high maternal mortality, inadequate preventative care, and dependence on imported medicines, commodities, equipment, and vaccines. Interesting. They are aware that Nigeria is currently affected by the brain drain, but prior to the brain drain, our human resources are grossly inadequate. We are not yet there. Well, it's actually kind of late, to be honest, because a lot of people are making plans. I think the only way to attract healthcare workers is not to say, come back and then we'll start. No. I think what they have to do, just don't talk. I think the thing about this government, just don't say your plans. Just start making a system, especially, with a lot of public hospitals, refurbishing them to a good quality standard. When it comes to electricity, actually sort it out, right? With 24/7 electricity, and in a lot of first world countries, the only building that would have a generator is the hospital, right? Because that is where emergencies take place. I mean, there are a lot of power cuts in several places in the world, but there can't be a power cut in a hospital, right? So again, electricity is something they need to sort out, and with generators, that's where it should be going. So sorting that out also means they have to sort electricity for all of Nigerians, but also just increase the salaries, right? For those that are, of course, still training nurses or whatever, you integrate them little by little into the system and make the system, attractive for those to go into it. I mean, the society and societal pressure on being a doctor is already, obviously, I know times are changing, but it's obviously a traditional job that is well respected, and it's a needed job to go into. So it's not like as if there will never be doctors. The government just has to make the system bearable, pay good salaries, make sure that people are trained properly, because it's very, it's very shameful to have that in the Nigerian doctors in, America, especially America, because that's where we hear the news from. But we hear that in America, they're performing, the most ridiculous, but, interesting and life-changing surgeries. But you never hear that from Nigerians from Nigerian medical schools in Nigerian hospitals. So asking, people or Nigerian healthcare professionals who've left to come back, what are they going to come back to? And it's the same thing with, other sectors in Nigeria, a lot of people who are skilled and have degrees, engineering degrees, and accounting degrees, all Nigerian skilled professionals, if you're luring all of them to come back, there has to be a system in place. So I think making your plans and just explaining what is happening and what you plan to do when you haven't done it yet is a no-go. It's like you make it harder to achieve for yourself. And the government doing that, in my personal opinion, doesn't make sense. So imagine how triggering it is for Nigerians to hear this. Regardless, people are going to be of the stance that until things are better, as in when we see the government taking steps, let's say in a year's time, they take it seriously that all the public hospitals are refurbished, because the private hospitals and the charges on people is just ridiculous. And so I think all these things are what is used to label the Tinubu government as active and working, but these are just things that are to be done, that are just said but haven't been achieved, but it's like a teaser for what hasn't even happened. So rather than tease, or then, because I feel like they would use this and as the things that Tinubu did, he in the WHO organizational plan, whatever, we actually mentioned that we're going to do this, we gave out the strategies, we just want you to execute. Nigerians are simply tired of hearing everyone just talk and talk. Anyways, put what you think in the comment section below, and do not forget to like and subscribe.